So another sign that your body might be getting ready to birth or to labour is having a show or the mucus plug. I've got a little knitted uterus to demonstrate this to you. So the darker pink is the bulk of the uterus or the womb, and the space inside which your baby grows. The paler pink is the neck of the womb or the cervix, and during pregnancy the neck of the womb is tucked backwards about 4 to 5 centimetres in length and thick and tubular. Within this tube sits the show or the plug of mucus, and this helps to keep the cervix closed and protect your baby as it grows during the pregnancy. As your body begins to prepare for birth, what happens is the cervix starts to come forward, it starts to lose its length and thins and softens and shortens. This is a process called effacement, and as this process happens, this plug of mucus becomes dislodged and comes away. So what does the show look like? Well, the show is sticky mucus. It can look a little bit snotty-like in appearance, and very commonly is streaked with some pink or some red. If you have a look at the pictures, you will see some different examples of a show. And the commonest one, I would say, is the bottom left-hand corner as you look at the screen. Sometimes the show is much heavier blood stain than this, but the fact that it's definitely sticky and mucousy reassures you that it is a show. If you think you just have some bleeding and it's not sticky, then it's really important that you give us a ring and let us know, and we're likely to ask you to come in so we can have a look at this. Will I lose the show all in one go? Possibly. Some ladies do have a significant clump of mucus that comes away, but more commonly a lady might go to the toilet to empty her bladder, and then as she wipes finds this sticky mucus on the tissue paper and perhaps into her underwear. And then as she continues to pass urine, each time she wipes she may notice a little bit more of this show come away. So some ladies may not even notice a show, and it might be something that happens much later on in the birth process, and you're not aware of it. So what to do if I think I've had a show? Well, you'll have been given an estimated due date or an EDD, and the clue is in the word estimated. It's not an exact science, it's an idea of when your baby may be due, perhaps based on the first day of your last menstrual period, or perhaps on the first scan in your pregnancy. Very few babies do arrive on their due date. It's thought about 1 to 4% of babies actually arrive at this point. So if you are over 37 weeks and you think that you may have had a show, then perhaps get a little bit excited. It's a good sign that perhaps your body is getting ready and preparing for the birth process. But it could be that actually you don't go into labour for maybe a matter of days or even a week or so. If you're a little bit unsure and you want to just check out that yes, it definitely is a show, then by all means give us a ring on Maternity Assessment Centre in the opening hours of Monday to Friday 8 till 8, or outside of those times to delivery suite. We will likely ask you if you're feeling any contractions, if you think your waters may have gone, and if you are happy with your baby's pattern of movements. And then just advise you just to wait and see what happens. If you have a show and you're less than 37 weeks, then it may be that we ask you to come in and to do some checks on yourself and on baby, because having a show less than 37 weeks could be a sign that your baby might arrive a little bit early or prematurely. So we may wish to do some assessments to understand whether there's a chance your baby may arrive early.